if you were watching me with the first interview with a narcissistic client, or even a first, second, third, it's an ongoing part of the work, but you'd see almost immediately that my focus would be on the way, in this case I'll say he because I work mostly with narcissistic men, the focus would be on the way he is relating with me, how it feels between us, the relationship, because I'm immediately going to start by defining the treatment room as a kind of laboratory or a microcosm of the greater world outside. We immediately make it relevant to what happens in his life outside the treatment room. So even if he begins by blaming, he says, I'm here because, I shouldn't be here. My wife is crazy. I'm here to appease her. She's the one who should be sitting here because she's unreasonable and because she's hysterical and she has all these emotions. But okay, to shut her up, I'm here because I can't deal with all this. I have important things that I have to take care of in my life. And he's on and he's pointing the finger. And I might say, it's interesting as I listen to you, we'll call him Joe. As I listen to you, Joe, I get the sense of what it might feel like to be your partner in a relationship, where in all of what you just said, I didn't for 1 minute hear any part that you feel is your contribution to the conflict. And we know, right, that universally speaking, that to have a conflict in a relationship, it usually takes two parts. I'm not hearing anything about your part. So I wonder, I'm not saying you're wrong, Joe, but I'm saying that I wonder to what degree this is part of the frustration for your wife, that there's no part belongs to you. You have no responsibility in the conflict. So you'd immediately see me pointing out how it feels. I will take on the role of the boss or the wife or the adult child who's not speaking to the parent anymore, or the sibling or the friend or whoever it might be. That's raised the bar and finally confronted them and finally said, that's it, get some help or get out of my life. I will take them on if they're doing it with me, well, you therapists, and all your psychobabble and all this jargon, and I might immediately say, I know it's not your intention to want to maybe be hurtful to me per se, but it is pretty off-putting. I mean, is this the way you would talk to most people who you just met for the first or second time about their profession? So you're almost immediately talking about what it feels like to be in a relationship with them. Okay. And so that's what you would notice. You would notice that I'm not theorizing. I'm not being theoretical. I'm not even asking too many questions just yet. I might follow that with a question like, how long have you been doing that when you feel uncomfortable or when you feel upset or when you feel like you have to do something you don't want to do? How long have you been responding this way? Or where did you get that message? So I want to understand it, but you notice immediately that it's about the moments that are occurring right there between us.